5. Mechanotherapy, or the use of mechanical equipment to facilitate movement in areas of the body.
We're continuing with therapeutic modalities, and we've covered so far heat and cold and light, low-level light or laser therapy. And we've covered percussion a little bit, but we're coming back to look at percussion. And I'm being assisted here by Dr. Bonnie Lever in working on my patient. What I've done here is I have created a cushion so that when I apply the percussion device, which the actual part of this unit of the thumper that presses into the skin is actually somewhat rubbery, but it really is not very soft, and it would not be perceived by a patient as particularly comfortable if you ran over a bony area where there wasn't a lot of padding, due to skin and fat. So it could create problems, especially elderly patients. Again, if they have thin skin and they have bony areas that project out, this unit would be quite uncomfortable. It could actually bruise a patient or injure their skin. So you want to avoid that by creating a cushion. And here I've taken a small towel and I folded it. I'm using a much smaller draping area just for purposes of demonstration. And once again, I would normally be working directly on an area where the patient had disrobed and was properly surgically draped in the medical massage technique. But I'm not doing that for modeling and simulation purposes. But here you can see the towel. The towel is folded. It's thick. It's probably about 3/4 of an inch thick. And over that I have placed a pillow slip. So once again, this could be anywhere from 1 to 5 layers of toweling, depending on the area that I was working on. If I was working, for instance, directly over a large area of muscle mass, and maybe there's a relatively sizable skin fold there with the subcutaneous fat, then I don't need as much toweling over an area like that. If I'm working directly over a bony area, as I am simulating here, then I have to have the toweling to prevent injury to the underlying tissues. And I simply, once again, I just kind of set this here, and I get ready to turn it on. When I turn it on, I pull it off slightly so it's not in contact, and then I turn the unit on, like so, and then I simply bring it back down into the area, and I begin to move it around and move it over the area that I want to percuss, being certain to get into all of the different aspects and really kind of following not only the bulky area of the muscle, but also the attachment points, the origin, the insertion, and the main bulk of the muscle as well. And what this does is it helps the muscle to relax. It improves blood circulation, fluid drainage out of the area. It stimulates the mechanoreceptors in the tissue, which helps to block and to diminish pain. A lot of very positive benefits to percussive therapy. There are a number of contraindications, but one of the main ones is not to use this over an area where there's been neurological damage and where there may be spasm in the muscle due to nerve root irritation or again damage or disease in the nerve itself.
The physiological effects of mechanotherapy include decreases pain, decreases edema, decreases muscle spasm, decreases inflammation, and increases circulation.